Everyone just heard that and make sure I heard you correctly as well. The way the budget stands now, before Representative Harris's amendment, $233 million is going to TOPS. If we took $204 million of that and put it towards the Department of Health, toward these private-public partnerships, every one of these hospitals will stay open.
I believe that's correct because it would fully fund them at the level that we have indicated to them we would fund. And this is the essence of what is the Sophie's choice that you have that I talked about in committee, where you're having to pick between TOPS and healthcare because there are only a limited number of dollars available right now to be able to adequately fund both of those needs, both of which obviously are very important to the governor and very important, I think, to you in this chamber and important to the people of this state. But absent the revenue to do that, we simply are unable to provide the level of funding that's required because we have to have a balanced budget, and we should.
And listen, and I serve on a TOPS task force, and TOPS is very important. Education is very important. TOPS is a scholarship program, though, is it correct?
It's a top scholarship based upon the performance of the students during their high school years.
And so this is a choice between a scholarship program and a life and death choice on how we're going to fund hospitals. We had Jeff Reynolds testify earlier that if these cuts come through, it would be reasonable to expect the loss of life because people won't have as much access to health care that they currently have. Is that a fair understanding of the choice that we have?
I'm not going to speculate on the potential loss of life, but I will speculate on the absence of access to health care, which is going to be a very serious problem for folks all over the state if they don't have access. Remember, because so many are getting primary care now under our arrangement with the hospitals, they won't have that primary care anymore. They won't have options of going anywhere because the hospitals will either be reduced in services or not open. And the end result is going to be people are going to do what we've tried to educate them not to do, and that is show up at any emergency room that may be open, because at an emergency room you can't refuse treatment. So it's going to create a lot of problems from that standpoint as well.
And I understand thousands of our kids benefit from TOPS. My question is, and I don't know if you know the numbers or not, people will be affected in Louisiana if we lost these 7 hospitals.
I don't know a number. I can't give you a number. I can tell you it will be catastrophic. Just by looking at the number of patients who receive treatment, looking at the fact that these hospitals will not be available in the communities or will be a very reduced availability, the consequences are dire. And this is the reality we've been saying is going to happen if we get to this point in time. And unfortunately, we're here, but we gotta fix it.
Thank you, Mr. Commissioner.